Presenting one of its kind, Dr. Haribhakti's Atlas of Robotic GI Surgery using SSI Mantra, a journey of precision innovation by the experts. Project initiated by Dr. Haribhakti, co-edited by Dr. Tushar Dave and Team Kaizen. Published by Haribhakti Education Foundation, supported by Kaizen Hospital and SS Innovations. Hello, welcome to this presentation on Haribhakti's Retractor. This is a table-mounted, self-retaining abdominal wall retractor, which is an invaluable tool in GI, hepatobiliary, pancreatic, and pelvic surgery. So we all know that during our residency times how we used to hold retractors and develop fatigue. Every human is prone to fatigue. Constant retraction can definitely lead to fatigue. That's why our preamble or our punchline for Haribhakti's retractor is that let retractors retract and let the assistants assist, because the assistants should be free to do helping the surgeons rather than holding the retractors and retracting the abdominal wall. So abdominal surgery is a challenge. In open surgery, as you all know, there are so many organs which will come in the way, especially for upper abdominal surgery. The rib cage comes in the way, and that's why it does not allow us to access the G junction, the stomach, the spleen, the pancreas, and the liver. And in the lower abdomen, deep in the pelvis, we know that rectum lies very deep in the pelvis, so we need to retract the abdominal wall to reach there. And in the mid abdomen, there are several small bowel and the other organs which will come in the way. The abdominal wall itself has to be split apart so that we can do the procedure what is meant to do inside. So normally the assistants are the ones who do the retraction during surgery, and that's why you need an additional assistant. But if we use a retractor system, we can reduce one assistant. There are several self-retaining retractors are available, Thompson's, Walters, but they are very prohibitively expensive for our routine usage. That's why we present Haribhakti's self-retaining abdominal wall retractor, which has been used by very simple, unique, adjustable table-mounted retractor, which saves time, reusable, sterilized by autoclaving, and it is used in many of the surgeries for many years now, more than 20 years of usage. So there are two types of Haribhakti retractors. One is the costal margin retractor, which is like an arch-shaped retractor, which is mainly used for the upper abdominal surgery, but this can also be used in the pelvic surgery. The other is called the abdominal wall retractor. This consists of two rods on which the retractors get attached, and this is mainly used for the midline incisions of the abdomen, either upper, middle, or lower abdomen. But both these retractors can be used by both the incisions. It is not that this is restricted to its use. This is what I'm saying is the predominant use of the retractor. Now, how this Haribhakti retractor was born? In 92-93, while I was doing my senior residency at AIIMS GI surgery, we used to do a lot of shunts and HPB surgery, and that was a time when surgeons used to hold the retractors for long periods of time. During my MCH residency training at SGPGI from 94 to 96, we also had an excellent exposure in open HPB surgery where we missed some kind of a retractor system. So when I came back to Ahmedabad and started at VS Hospital doing some shunts and other HPB surgery, I realized that I needed to develop something which can be helped. So we developed the first prototype of the retractor. We used to fix it to the anesthesia trolley, and then subsequently we developed a table mounted system, and in 2000 we developed the final prototype and commercialized the system. Since then, almost 25 years, a lot of institutions in the country, including AIIMS, SGPGI, Sri Chitra, Ma Amritanand and Cochin, and all these institutions used this Haribhakti retractor for the routine hepatobiliary pancreatic surgery, and many surgeons also in their own practice and clinics are also using this retractor very effectively. So the salient features of the Haribhakti retractor is very simple in design. It's a table mounted system so that the strength is very good of retraction. It fits on all the operating tables. The same sockets that I use are used for the Haribhakti retractor, so no special device is needed, no special table is needed. It is very easy to apply. If the OT staff learns, it takes about 5 minutes to apply this device on both the sides, and it is very easily readjustable during the surgery due to the design of a hook and a socket design. It's very easy. Just remove the hook of the retractor, make it more tight, or apply it at a different area. So it's a very easy to reuse during surgery. It gives a very effective and traction, which gives an excellent exposure of the operative field, and it is a sustained and a steady traction which avoids the human fatigue, and this helps us to free the residents to assist in the surgery. Apart from this, it is easily sterilizable by autoclaving, and it is reusable. So one time use, one can use it for lifetime. The life for 25 years, people are using it in different institutions, the same retractor system. So there are various applications of the costal margin retractor. When it's applied from the head end, it is used mainly for upper GI and HPB surgery, especially the liver resections, pancreatic surgery, LPJ, Whipple's, distal pancreatectomy or necrosectomies. And it is also used for gallbladder and bile duct surgeries, the CBD explorations, cholangiocarcinoma, portal hypertension surgeries, splenectomies, LR shunts, esophageal and gastric surgeries, for cancers and for benign diseases. When the same retractor is applied from the costal margin side, it can be used for colorectal resections, for urological surgeries, cystectomies, radical prostates, open surgeries, and gynecological surgeries like hysterectomies, Wertheims, and RPLNDs. The method of application for the costal margin retractor is that there are two parts which has to be fixed it up and applied, and it can be reapplied during the surgery. There are different retractors that can be used, and they can be dismantled and stored in for autoclaving. I'll show all these details in a short video after this presentation. And the application of abdominal wall retractor is also very easy, and it also can be applied and readjusted very easily. There are some precautions that we need to take while using the Haribhakti retractor system. We must use mops between the retractors and the abdominal wall so that the retractors don't slip out, especially when there is excessive traction. This avoids any constant. We should avoid very constant, heavy, sustained retraction, because that can cause some pain to the patient, and that's why in areas where we are not really working, we should loosen the retraction during the surgery, and we should release the traction and then reapply the traction where we are working. In some areas, for some temporary times, we can apply a large force or a severe traction and retract it properly. But then as soon as that portion in that area is completed, we should relax the traction to avoid post-operative pain. So to summarize, the Haribhakti's retractor is a very affordable, available one-time retractor for open abdominal surgery. It provides excellent exposure of the deep cavities. It opens up the upper abdomen like a book when we are using it for effective traction of the HPB and upper GI surgeries. The distributors are from Mumbai, Shriji Surgicals. We do not charge them any royalty so that the cost benefit can be passed on to the surgeons. And we thank all the users so far who have appreciated the retractor and given us feedback and suggestions for improving the design of the retractor. I will be showing a short video of how this retractor can be assembled, used during the surgery, and readjusted, both the types of retractor.